Hello and welcome to This is 65. My name is Erin Ackenheil and I own Blackpoint Insurance. At Blackpoint, we help Medicare beneficiaries nationwide learn about the A, B, C's, and D's of Medicare, and we help agents and brokers launch, grow, and retain their businesses. Through that process, we meet some amazing individuals, entrepreneurs, side hustlers, people in their encore career, people who are authors doing amazing things in their communities and giving back. And we bring them onto our show and profile them here. And I am so excited today, beyond excited, to bring back one of our most popular guests, Adrea Brier. She's coming back onto the show today. And most of you know that Adrea is an integrative cancer consultant and a patient advocate. The work she does is incredible, using integrative medicine to give people better outcomes and hope in their life. She actually consults clients internationally, teaching people to conquer cancer. Adrea herself has extensive experience in integrating the benefits of conventional medicine, complementary medicine, and all forms of healing that strengthen the body's ability to conquer cancer. She's a sought after speaker for cancer conferences, and she's a motivational speaker across the world throughout businesses. Today's focus is all going to be about something called Jin Shin Jyutsu. Adria is going to teach us all about that today. And so without further ado, I want to bring Adria back on the show. So welcome, Adria. How are you?
I'm fine, only I'm likely blushing from that incredible introduction.
The introduction precedes yourself, right? I can't even say enough for the wonderful work that you do, and you're such a great person to work with, professionally and personally. And I just think you're outstanding, and I love all the things that you're doing out there. So, for those who haven't met you before, Adria, can you just do a quick reminder, refresh? What's your story, and tell us a little bit about yourself?
I'm happy to do that. First, though, I need to thank you, Erin. Many people have been through the mill on getting good insurance guidance, and you are the first person who knows Medicare, who teaches your clients, who shows us, who gives us professional information, who has a staff to follow up with our questions. I've never encountered anybody like you in the Medicare and insurance world, and I wish that there was somebody like you in the other insurances. So, as you know, I've sent my colleagues, doctors, patients, clients to you, and I'm grateful for your help of me, and I'm grateful for your help of them. So, thank you for your life mission.
Thank you so much, Adrian. Now I'm the one blushing. Thanks so much. Well, and that's probably why we like each other, because we're both trying to do as much as we can for others and do good work out there. So thank you so much.
Making a difference, right? So, in terms of my work, I'm an integrative cancer consultant, as you said. My practice is international and has always been virtual. I'm an advocate, and by demand, my practice evolved into life and relationship coaching because emotions and relationships underlie just about everything. And I'm going to give a little example of the way I work. Here's my hand. These are the underlying causes. And when we have the underlying causes hitting the physical body, it manifests in disease and relationship issues, including our perception of self. So my work is to always get to the underlying causes. And when it comes to, and that's of any disease, when it comes to cancer, the underlying causes are brewing for decades. And let's just say it takes 8 to 10 years for the symptoms to show up. Cancer is a symptom of the causes of the chaos underneath the body. It's like, let's say we cut ourselves and we put on a Band-Aid. Well, the Band-Aid may stop the blood, but what caused us to cut ourselves to begin with?
Right.
That's my whole work. And that's how the life and relationship coaching became part of it as well. So I do that basically around the world. Sometimes it's with an individual, sometimes it's with a couple, sometimes it's with a family. But
Right.
I love my work. And when I was first diagnosed in 2006, I mean, I'd been a health baby my whole life. In the 70s, when probably some of your people may not have been born, um, I was looking for organic, and people thought I was a fruitcake. But I was fortunate because we all have our gifts, and two of my gifts are intuition and psychic abilities. So those abilities and my guidance allowed me to navigate the conventional medical system and act as advocates for seniors and veterans. Then, fast forward 2006, I have a diagnosis of breast cancer. And it was, what did I do? I drowned on the computer because the first thing you do is try to find information, and all that information is terrifying unless you have
Right.
some guidance. So my objective is to give people information. Information is power. When they have all the information, gathering information is not a decision. It's the information with which we make decisions.
Right.
And we choose to do conventional, alternative, integrative, whatever. We need to do something because cancer is a wake up call. And it will ultimately, for most people, be chronic because those causes of decades don't disappear in 6 weeks, or if we do a certain kind of treatment or take out a tumor, those causes underneath are still there. So
Right.
my
And you still have to, right.
exactly, we have to get to the causes. So again, so any cancer episode, and I want your people to understand this, is usually going to be chronic. And my objective is to make sure any additional episode is further and further apart, less and less virulent, so that ultimately the body can conquer it on its own.
Right. Well, one thing
That's
I just want to bring up for everybody right away, Adria, is because I know some people are getting this diagnosis right now, listening to us, they're hearing this, they don't have the backdrop of this, they're just, kind of information overload, right? Dr. Google and all the information, and what do you do with all that, and how do you process it and make a plan and, you know, help with the chronic components of this. And Adria is amazing. I know she takes people on. And Adria, I just thought it'd be great. I know you're so accessible. Can you just tell everybody how to reach you if they're really in need and needing your consultant services?
I'm in California. You can call me at 2 o'clock in the morning because my phone won't ring. You can leave me a message. Okay? I have to because I've got an international practice, so I get calls at crazy hours. 415 308 4818. Just call and I'm here to help. This is my world. This is what I do. I love it.
It's incredible what you do, Adria. And, just in terms of if people were to call you, what could they expect? Like, what's the first step in the process in working with you? How do you figure out how to get them on the right path?
We set up a time to have a consultation. I try to condense their history into an hour and a half if we can. So the first consultation's an hour and a half. And then if we need other consultations based on what they need to cover, we'll have them. I saw a relationship, a marriage change in one consultation. Sometimes people have a lot of emotional issues or relationship issues with others. So we might have 3, 4, or 5 consultations, and they'll call me again in 6 months for a tune up, or they're going to see their doctor and they don't know the questions to ask. And then they get information and they want to know how to integrate the information from the doctor into their health plan. So they'll
Right.
set up another consultation. Each person's different. I focus and we focus together on what they need.
Right. And that's what I love about you. You're so collaborative, and it's all about really customizing to their particular needs and helping them figure out the right path. So that's incredible. So let's talk about the new thing. Let's make sure I can say it right. What is Jin Shin Jyutsu? How did you learn about this? What is it all about?
I'm going to explain that in just 1 second. I want to tell one little story, and then I'll tell you other stories about Jin Shin, and then I'm going to walk everybody through how to do this on their own time in their own environment.
Great.
They'll leave your presentation with information and ability to do this for themselves at home.
That's incredible. I love it.
Amazing. So I want to tell one episode when I was going to Russia in 2019, and I felt some discomfort down in my pelvic area. I asked my gynecologist for a pelvic ultrasound. We did it. She called me in her office. She didn't look good or happy. And she started talking about surgery and drugs and this and that. And she said, Adria, you have a growth with a blood supply. We have to be serious about this. And I looked at her after she talked about surgery and other things. And I said, Mindy, that's not my paradigm. I'm going to Russia in 3 weeks. Let's do another pelvic ultrasound after I get back, after you get back from vacation. And I'm going to do what I do to conquer this. So I did what I do. I still had my desserts. I had my wine. I had bread. I'm a French fry addict. So I'm gonna cut back on that
I
'cause
think we're soul sisters, okay? Like that's for sure.
now I'm doing it in my air fryer, but I did
Good. They're actually delicious. We'll have to
everything.
do an episode all about air fryers.
We can do that. I don't even use my oven. I probably haven't used
Oh.
my oven for decades, but when I came back and I did everything I wanted to do while I was in Russia, I didn't have this, "Oh, you're guilty," all of this. I came back, it was about 7 or 8 weeks from the time I felt my first discomfort. I went in, I did what I do to conquer cancer. I took it with me, and we did another pelvic ultrasound, and there was nothing there. There was no growth. There was no blood supply, and cancer has a blood supply. So, quite frankly, the Western doctors, many doctors, don't even know how to understand that because that's not their training. They
Right.
don't, as caring as they may be, they don't even know the questions to ask. And not only that, but if they give people information outside of the traditional medical paradigm, the conventional paradigm, they could lose their license.
Right.
So they don't even want to know what I do.
What was the reaction of your physician when you came back and got that clear result?
Surprise, grateful, happy for me, totally didn't understand, and we just went right by it.
That's crazy. I mean, I just feel like, obviously there's definitely a place for Western medicine and the treatments and traditional and
Right.
so forth, but the balance, the integrative approach is huge. And look, you're just a proof positive example of that, even in your own right. You've experienced it, right? So that helps you to tell your story and do your work out there. That's unbelievable.
Totally. I had a man referred to me from Wales in the UK, United Kingdom, England,
Hmm.
Great Britain. He was given 3 months to live. 3 months to live. And 5 years later, we're still trucking strong. He's traveling. He's happy with his wife. I had constant gratitude from him. It was just, and he was older. So ultimately he did, go into another space. He caught COVID, which is another thing that I don't even go near. It's a virus. People need to deal with viruses and support their immune systems. Whole other conversation.
Right.
Anyway, I love my work. I'm happy to do it. I'm happy to talk to people, and I welcome your people. The only thing I ask is that when they call me, they tell me that you sent them because I receive referrals from doctors in different parts of the world. They meet me at cancer conferences where I'm speaking. They find me online. People
So for
just
everybody listening to this in the podcast form or the video form, when you call Adrea, just to remind you, that's welcome Adrea. Let's do call Adrea at 308-4818, area code 415. Be sure to mention that you saw her on the show or that you know me personally and you've been referred by me. I think she's amazing. And I think it's worth your time, particularly if you've gotten a diagnosis. Attack all the angles, be integrative, make sure you're addressing the core issues that made that come around in the first place, because everybody knows somebody who's had cancer. Lots of us know people who've had repeated occurrences of cancer, and so just getting connected with someone that can help with that conquering, so to speak, I think it's a really big deal. So Adria, are you ready to talk about Jin Shin, or do you have anything else you want to share first?
I think we're good, and I will tell people about Jin Shin. So, but first, what I want to ask people to do is to adjust your paradigm, right? Suspend disbelief. Just put that over here, what your belief system is, and open up your mind to learn something new. The
I'm
reason,
doing it right now. I'm going to be your visual.
right? I say that because we've all been downloaded with the same information, right? Except there are cultures around the world that are brilliant. Most of the people in the United States have a heritage from other cultures and other countries. Those cultures and countries have a wisdom to share. And just because we may have been born here doesn't mean that that wisdom isn't prevalent and present for us to take advantage of.
Absolutely.
Right? Chinese medicine, centuries of wisdom. Even the National Institute of Health in Bethesda, Maryland, finally recognized Chinese medicine and acupuncture. I mean, it's been around for centuries. It's brilliant. Jin Shin Jyutsu is the Japanese art of energy healing. And basically, The concept is when we have a disease state or a pain state, it's stuck energy. So let me say that again. Disease and pain are energy stuck in the body. There's an interruption in our flow. There's an interruption in the innate healing wisdom of the body because nothing, and I say this when I present at cancer conferences, nothing is smarter than the innate wisdom of the body. Not a drug, not a surgery, not the most well intentioned doctors. Our body is brilliant. When we remove the
Designed.
right, when we remove the interferences, Jin Shin Jyutsu is one vehicle in an easy, you will not believe how easy this is, an easy way to remove and mitigate some of those interferences.
How did you learn about this?
Oh, I had been working 94 hours a day. I
Uh-huh.
needed,
Well, just 94.
right, this is in 94 when I was living on the East Coast. I needed a break. I went to a place called Kripalu, and they had, and I always share when I go to a conference, I like to share a room with one person because I think a like minded person might become a new friend or someone I can learn from or someone I can share with. So I'll share with one person. And this one person in this room was telling me about Jin Shin Jyutsu. We talked about it. I let it go out of my mind. I don't know how many years later I moved to California. One day I get this notice on my mail about Jin Shin Jyutsu. I said,
Like, I've heard of this before.
right? How did this even find me? But I believe in guidance and I believe in manifestation. I didn't care how it found me. It intrigued me again. And one of the pieces in my world is if something shows up, I want to notice. And if it shows up a few times, that's guidance. We can disregard it or we can take note and see if it needs action. I took
Right.
note. So I called, I had gotten a email from someone also about a program for the weekend on Jin Shin Jyutsu. And I said, okay, one and one make two. Open your eyes, girl. Something's happening here. And I put everything in line to attend that conference for the weekend. Well, it gets to be Thursday before the conference. I still haven't called Janet. And I called her and I said, hey, I'd like to be in your program. And she said, Adria, I am so sorry. It's full. So I
Oh,
told her
no.
this whole story I just told you. And she, much to her credit, she said, you know, you must be the person who's supposed to be here. I'm just going to make room for you. And I thought, okay, that's point number 3. I'm supposed to do this work.
She's lined up with it too. That's incredible. What a story.
It's amazing, right? It gave me chills. And since then, I've been, I mean, I can tell you a few different stories. I took multiple classes. I mean, I can't tell you how many weeks of classes, many more than you needed to be certified. But I love the work. I love my whole paradigm, even in, dealing with cancer, is self-empowerment. I want people empowered in their own environment. I'm working with brain issues now, not for myself, but helping other people with, brain health. I
Right.
want them empowered in their own environment. And that's basically what I do. And that's what Jin Shin does. And that's what some of my, cancer information does. So with the Jin Shin, I had a colleague who was very, very Western. She won all kinds of grants, very Western. Anything I had to say about energy, it was like, or Chinese medicine was not on the table because she'd get irritated. Okay? And, you have to respect other people. And I respected her. And she wound up having a growth. She had myasthenia gravis and a couple of other things, but she had a growth and she was really worried about it because it kept growing. So I said to them, I'm going to another 5-day session. If they will let you come in and be worked on, are you interested? Much to my surprise, they said yes.
She was open.
So I asked the teacher, and they made an exception for this woman. You got to appreciate the gifts that people give us.
Right.
And they worked on her because when you're in the class, you have people working on you and you take turns working on them. They worked on her, and this growth stopped growing because
Unreal.
she went home. I gave her the name of a local practitioner, and she started working with us. And she told me that when she stopped doing the self-help that some of which I'm going to show you today, it started to grow. And when she saw the practitioner or did the self-help, it stopped growing. Now, this is from someone who is skeptical beyond belief. In fact, when her daughter went into the hospital with lymphoma, she had the Jin Shin practitioner go into the hospital and help her daughter.
Well,
That's
that's
how
how powerful it is, right?
very, very powerful. My father, myself, I was having difficulty walking. My knee was bothering me. I went into the session, the 3 days, and I said, "What do I have to do here?" She had them work on me with what we call flows, and I'll explain that in a little while. I got off the table and I was walking fine.
It's incredible. That's amazing.
It's, the wisdom of the other cultures. We need that in our lives. We need Ayurveda. We need Chinese herbs, which I have my clients taking. I make an introduction for them. We need all of that in addition to when we need our conventional medicine. But we have to work with the strength of the body. I'm going to tell you one more story. My father was in Florida. I was in Los Angeles. And he called me, or I called him, and he said he has to have open heart surgery. So I went to the teacher and I said, what fingers, and I'll explain this later, are related to the heart? She told me. I flew down. So I said, Dad, I want you to do this until I get down there a few weeks later. I get down there, and Dad had had a cardiologist who was on the cover of the magazine in the state of Florida because he was so well respected. They had done an ultrasound 10 days before the open heart surgery. And the ultrasound showed he had a few valves that needed replacing and he had blockages. So the doctor said he'll be out early afternoon and he'll come and tell us the result. Great. The night before his surgery, I worked on Dad for about an hour. When I say work, it's nothing, it's placement of hands to clear the heart energy blockage. You have to clear the space before the issue and the space after the issue. So we call them projects, so that the energy can flow when you're doing your work. The next morning, I did that for about an hour. The doctor comes out late morning, and my brother and I looked at each other, and it was like, uh-oh, we're in trouble here. He's out early. And the doctor sat down and he said, we don't know what's going on with your dad. We did an ultrasound 10 days ago. We saw his valves were needing replacement. His valves are healing. And he did not need to have open heart surgery. We could have done this a different way. He said, when I saw this with my own eyes, I called in one of my medical colleagues and I said, are you seeing what I'm seeing? And they did. So understand that this is the first time I've done Jin Shin Jyutsu in a serious way, besides just on myself, where I could see 1 and 1 equaling 2. And I thought, in my brain, I'm thinking, this just isn't possible. But in my heart, I remember practitioners in the classes were saying about how people got healed. And I thought, okay, totally suspend disbelief. There is so much in this world we don't know. And in fact, one of my favorite phrases is, we don't know what we don't know. And even the most well-meaning doctors don't know what they don't know.
None of us know it all, and there's so much to learn, so much mystery and so much to learn.
Right,
So
constantly. So
that's
let me,
incredible. What an amazing situation, and when I think about how you got placed in the place you were supposed to be, even though against all odds, and then you get to see that real impact on your own dad. I mean, that's incredible. So I love that. So you were talking about the hands and placement, and I just remember you telling me something that we work with self-help through the hand and fingers. Can you tell me a little bit more about the concept and what that means?
absolutely. So we work with self-help. The easiest way is through the fingers. But we can work on self-help. Like when I had the first diagnosis episode, I like to call them episodes because episodes are transitory. And when we say my, we're taking ownership energetically and cellularly. We don't want ownership of anything we don't want. So when we work with the fingers, basically, this will be an easy way to remember. Let's see if you can see my hand.
I
Okay.
can see your hand. I got it.
So the thumb is constituting worry, right? The spleen, the stomach, discomfort, more acid in the stomach. The first finger, and we can remember this from fear. Where are we?
I
F,
see it.
F, E. I'm not even going to show you my hand. Fear. It's called fast, starting with the index finger. Fear, anger, sadness, and trying to. So again, going back to the thumb, worry, stomach, right? Creates discomfort, creates acid. Fear, the index finger, we wind up oftentimes going to the bathroom more than normal because we're so anxious. It's affecting the kidney. Anger is the middle finger. It affects the liver and the
Isn't
gallbladder.
that just appropriate?
And we think it's all coincidence, right? There's so much that we don't know. I never thought of it that way. You're
Well,
bad.
you've got me for that.
Right, right. The fourth finger is sadness. What happens when we're sad? Our lungs, right? And that's also anxiety. We breathe, we just like, and everything starts to shut down when we're sad. The pinky is related to the heart. It's too much effort, it's too much stress. So, when we work with the fingers, we're working with worry, fear, anger, sadness, and too much effort. And remembering that when we're working with these, each finger is related to different organs in the body. Like I worked on my dad's heart. So, worry, the thumb, is say the spleen and the stomach and the surface of the skin. The index finger, kidney, bladder function. The anger finger is the gallbladder and the liver. Liver is so important, and very much so in cancer, because that's where the estrogen metabolites become healthier balances in addition to what else I do with people. And the estrogen metabolites, when they're out of balance, feed cancer, prostate cancer, brain cancer, ovarian cancer. Go back to the fourth finger. That's the lung and the large intestine. Go to the heart, the pinky, and the small intestine. So as we work with the fingers, we're working with the emotions and we're working with the organs in the body. And we're clearing the energy centers because we are energy beings. We are all energy. It's not like you can put hydrogen and oxygen together and get water, the same way the body is a complex system and all of our systems interrelate. So when there's an imbalance or a pain or a disease or a structural imbalance in one part of our system, it's the body is so smart that it tries to compensate. But as it's compensating, there are ramifications, right? So let's say there's a structural imbalance, and I love osteopathy. There's a structural imbalance and somebody's upper cervicals are out of balance. They may wind up having knee pain or back pain or a growth on their foot.
Right.
In conventional medicine, they're going to cut the growth. Well,
But that's not where the problem is.
exactly. The best way to start with any of this, in my humble opinion, is to go to underlying cause first. And then you go up the ladder, or to me, it's down the ladder, of what's going to be the least harmful that I might need if I haven't been able to remove what I call the interferences.
Right.
It's just the body knows how to heal, and there's absolutely nothing smarter than the innate healing wisdom of the body. So we
100%.
take, right? We take advantage because we're energy beings. And here's another example. As we clear our energy and as we clear our disease states and our emotional state and the story by which we look at the world, our experience is the story, we elevate our frequencies. So that's a whole other conversation I should do for you and your people. But
Definitely.
here's an example of frequencies. Somebody marries an alcoholic, and there's no blame in that. Alcoholism can be a physical disease, not just maybe it's moved forward by emotion, but it's a physical imbalance, most people believe. So they divorce an alcoholic, and the next person they marry is an alcoholic. Why? Because there's
Underlying issue.
exactly underlying issues, frequency imbalances, and I work with frequencies. I work with energy. Even the brain work that I do helps to elevate frequencies.
Right.
Jin Shin Jyutsu works with frequencies. And all of this preamble is to let
Show
people
us.
know that this is work. We're going to harmonize thousands of body, mind, spirit, energy functions. It's like it's a meditation. I will caution you, do not do this while you're driving. Do not do this too much while you're in a meeting because you could fall asleep. Right?
Maybe this meeting, if I fall asleep, this will probably be the first video that goes viral.
That's all we need. It's very, very, very relaxing. So imagine that you have a hammock. The hammock, right? If you don't hang the hammock between the trees, that hammock is not going to go up. It's going to
Right.
be on the ground. Our hands, imagine that our hands are the trees. These are called jumper cables. And when we put our hands on or even 3 inches away from certain places in the body, we're creating a connection. And a simple way to feel this, and you don't necessarily have to do it now, but you could, when you put your hands close together, if you close your eyes, you feel maybe a little bit of tingling, a little bit of pressure between your hands. And if you don't feel it now because you're distracted, try it a few other times because you will ultimately feel it. We're energy systems. And we have energy around our body, we have energy around our hands. So when we put our hands in different places on the body, we're creating a jumper cable connection, just like in a car on a battery, between those hands and moving the energy in the body. And by moving the energy in the body, we're helping the disease state to move, the pain to move, and the energy blockage, which is the disease state, to move.
Incredible.
So, right? So
So
once,
I'm ready. I'm like, I'm trying this. Show me what's next,
all
Adria.
right, here's the synopsis. The thumb is about digestion, allergies, gut acid. If you didn't sleep well enough, you'll have this recording, so you don't have to write any of this down. It helps to increase energy function if you've got a stomach ache. The first index finger is about fear, again, anxiety, calming the system. The middle finger is about anger. It increases stress. Stress undermines our immune system. Stress is a direct corollary right to cancer. Stress hampers sleep. Anger increases stress. The ring finger, it's about sadness, grief, bringing joy back. The pinky, trying too hard, breath, making too much effort. So, what are we doing with Jin Shin? We are going to the positive side of all of these issues and reversing them. We want to mitigate them. All right, rock and roll.
Rock and roll.
Get yourself comfortable
Ready?
in your
Okay.
chair. In your chair, put your feet on the ground. Make sure your back is really comfortable. You don't, if you have to move your head around a little bit, do it. If you have to stretch your shoulders, we're going to do that too. Make sure you're warm enough. We definitely want to be warm enough. I'm very big on relaxation and warmth because getting a cold is not about getting a cold. Getting a cold is about the inner cold in the system. And that's why we always work with the immune system. So, are we ready?
I'm ready.
All right, shoulders up and back. Take a deep breath. Up and back. Oh, God, doesn't that feel delicious? Okay, shoulders up and back. Yummy. All right. Put your hands in a comfortable place. If you have a table in front of you, great. If you're going to put it on your lap, great. Please shut your phone. Shut your phone. All right, take a minute to do that. If it's near you, we just don't want the ring interrupting you. If you just want to shut the sound, and I'm going to double check
I'm
mine.
making sure. I was like, I think it is, but let me double check.
Great. Yep. Okay, so I'm double checking mine as well. We're going to start with the thumb. The thumb is about worry. I'll tell you each time, digestion, allergies. Remember that even if I'm talking while you're holding your fingers, your body knows what to do. All we're doing is helping it. You can do this in meetings. You can do it to get to sleep. You can do it on a plane. You can be sitting in a movie. Holding these fingers, it's the world's simplest thing to do. All right, so take your thumb of, say, your right hand and put it in the palm of your left hand. And then close your fingers gently around your thumb, like you've got rose petals around your thumb. Let your hand relax on your lap, just like that, Erin. But then let your hand relax on your lap or on the table in front of you. And don't squeeze your thumb. Let it breathe.
You knew I was squeezing it, didn't you?
Everybody does. Everybody does. It's like, okay, I've got it now. You know,
Relax.
am I doing it well enough? And that's everything in life. How much work do I have to put into it instead of flowing with the river? In life in general, that's another conversation. So you've got your thumb, your right thumb in the palm of your left hand. You've got delicate rose petals all around your thumb. So you're gently encircling that thumb and you're taking a breath. Just close your eyes, shoulders up and back. Take a breath and just hang out. We're going to sit like this for a minute or two, and then I'll take you to the next finger. There is no way to do this wrong unless you're suffocating your finger. So just hang out, relax. Your body knows what to do. Just breathe. Resituate your back or your butt if you need to. Be comfortable. If you're lying down, you can do this lying down. Breathe in. Breathe out. Breathe in. Breathe out. Breathe in deeply one more time to a count of 5 or 6. Hold it for 5 or 6 and breathe out through your mouth. We'll do it again. Breathe in through your nose to 5 or 6. Hold it for 5 or 6 and breathe out through your mouth. No effort. Just breathe in gently through your nose and out through your mouth at your own pace. Double check and make sure you're not suffocating your thumb. Give it space to breathe.
Breathing.
Breathe in and breathe out. Feel your body relaxing. Can you feel oxygen flowing through your entire body? Oxygen is the breath of life. And breathe out. And eventually, you're going to feel a pulse. It may be very faint at first, and you may not feel it today because you're just beginning Jin Shin Jyutsu for yourself. But eventually you'll feel a pulse. And it's not your heart pulse, it's your energy pulse. And when you feel that pulse now or in the future when you do this, just feel it for about a minute. And then the pulse will change. It may go from bop, 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 bop to bop, bop, bop. It will change. And once you've felt the change for about a minute or two, you can change fingers. So now we're going to change fingers. We're going to take the forefinger of the right hand and gently lay it in the palm of the left hand, surrounded by rose petals. Let your hands relax and breathe in through your nose. Hold it for 5 or 6 and breathe out slowly through your mouth. Breathe in again through your nose. Hold it. And breathe out through your mouth. We're a society of overdoers. You don't have to breathe in and hold to 20. And if all we can do is 3.
How did you know?
Right? And if all we can do is 3, then we do 3. All right, breathe in through your nose. And breathe out through your mouth. And breathe in through your nose. And breathe out through your mouth. Keep holding your finger, and I'm going to tell you another story. I had a woman referred to me from, I think it was Australia. She had just had a chemo treatment. Her face was really red. She looked exhausted because she's been trying to get healthy. Her husband was typing away with everything I was telling them during the consultation. And at the end of the time, we had time to do this Jin Shin Jyutsu for both of them. So I guided them through it. We had about an extra 20 minutes. When the time was over, I looked at her, and her face was so relaxed. Their eyes were closed. Her face was so relaxed. Her skin was just a nice, natural, healthy color. Her husband, her best advocate, had fallen asleep, which Jin Shin Jyutsu can do because it relaxes the whole system while it's helping it to heal. And I said to him, I want you to look at your wife and look at how peaceful she looks now, and look at her face. This is a gift that you can give yourselves. You can each do this every day, no extra cost. Just gift it to yourself and do it even before you go to sleep. So now we're going to move to the third finger, the middle finger, which is anger, stress increasing. Take the third finger of your right hand and place it gently in the palm of your left hand. And you know what I'm going to say next, right? You've got rose petals. Hey, don't squeeze it. Let it breathe. And let it rest gently on the rose petals. But you're holding it. You're creating a connection between both hands, between the finger and your other hand. You're jumper cabling. And this completes a circuit in your entire body. So breathe in and breathe out. Put your shoulders up and back again. We tend to go back into what we remember. Want it to release. Bring your shoulders up and back. Breathe in deeply. Bring your shoulders down. Isn't that delicious? Okay. Breathe in. Breathe out through your mouth. Breathing in through your nose helps the brain. It's one of my focuses for people. And breathe out. Breathe in and breathe out. Keep holding your finger because your body knows what to do even as I give you more information. Breathe in and breathe out. It is essential to support the immune system in advance of getting sick. We don't want to be sick. That's what my work is about. Empowering you in your own environment to stay healthy or get healthy. Breathe in and breathe out. Breathe in through your nose. And breathe out through your mouth. Do that a few more times and hold, and then breathe out through your mouth. Breathe in and breathe out. And breathe in And breathe out. Now just let your finger breathe, and we'll be still for a little while. Perhaps now you're able to feel the pulse. And again, there's no wrong here, there's only right. Eventually, with time, if you're not feeling the pulse now, you will. You'll build your body up to it. And in the meantime, you're still getting benefits. Hopefully, you're feeling the relaxation.
100%.
Yeah. And
I might take a nap.
we need you. Stay here. All right. We're going to change fingers again. I'm going a little quickly because I don't want to take up 14 hours of Erin's time.
Well, I have more time to do this on my own. I think just learning the technique is amazing.
Exactly. Thank you. So going to the ring finger, which is sadness and grief, we want to bring joy back. By the way, in Chinese medicine, the lung is grief. So when we're working with the fingers, remember that we're working with all the fingers. I'll tell you a story, but first, breathe in, hold it, and breathe out. Breathe into a count of 5 or 6, and breathe out through the mouth. And remember, you've got roses in your left palm. Hold your finger gently. Just encircle it gently and breathe in. Breathe out. Breathe in and breathe out. So keep holding, and I'm going to tell you the story, and keep breathing. No one here can stop breathing. Breathe in and breathe out. My mother had myasthenia gravis, which is a nerve and muscle disorder. It affects the lungs. She also had end-stage emphysema. Keep breathing and breathe out through the mouth. I remember one occasion when she was having difficulty. I said, Mom, I want you to hold your ring finger, which is about breathing. It's about sadness. It's about breathing. It's about the lungs. Breathe in through the nose and breathe out through the mouth. And her breathing got more even. Breathe in. And she calmed down. Breathe in. And breathe out. You just sit and do that at your own speed for a little bit. Close your eyes. Relax. Shoulders up and back. Sit straight from your spine. Your hips are a little forward. Breathe in and breathe out. Breathe in and breathe out. Breathe in and breathe out. Just relax for a little bit. Keep breathing. Let your finger breathe. All right, we're going to switch to the pinky. The pinky is the heart, remember? It's about much too much trying to, efforting, extra stress. the must do's instead of riding the river. We can work hard and ride the river. Take your pinky from your right hand and put it in the palm of your left hand. The rose petals surround that pinky. Let it breathe and take a deep breath through your nose. And breathe out. Breathe in through your nose and breathe out. Breathe in through your nose and breathe out. Our self-talk is very, very important. When we're growing up, we pick up the energies of the people around us. You know what, Erin? We'll incorporate that whole conversation into another time. Breathe in through your nose and breathe out through your mouth. Breathe in, breathe out. Just remember that life goes forward and we're as competent as we are. So we're going to do the best we can. Adding extra stress with all the effort of trying, just do. Just be who you are and do. And your natural talents and wisdom will come out to whatever the task is. Now breathe in through your nose. And breathe out through your mouth. Breathe in through your nose. And breathe out through your mouth. Trying too hard increases stress, raises cortisol, stresses the adrenals, direct pathway towards cancer. Not worth it, folks. Take a breath and ride the river. Breathe in through your nose. Breathe out through your mouth. Okay, everyone, close your eyes and be present. Breathe in through your nose and breathe out through your mouth. Breathe in through your nose and breathe out through your mouth. Please know that if you need a consultation just to release stress in your life and give you some pointers on helping relationships, you're welcome to call me for that too. It is essential to reduce the stress in our lives. It harms everything in our body. People around us pick it up. It lowers our frequencies, and we wind up attracting what we don't want in our lives. This is fact. Breathe in and breathe out. 2 more times. Breathe in. Hold it. And I want you to breathe in slowly now. Follow me. Breathe in. Hold it to 5 or 6. And breathe out to 5 or 6. Do that again. Slowly in. Hold it to 5 or 6. And breathe out to 5 or 6. One more time. Breathe in. And breathe out. Okay, we're going to switch hands now.
All right, Adrea. I think like for now, like I like feel like I've got the technique and I'm literally ready to pass out. Can't do it. Everybody knows how difficult it is for me to relax. That's like my personality. And I am zonked. I feel like amazing. And I feel like I need to do a whole nother session with you doing the whole thing. But my whole body is so relaxed right now and I feel so connected. I don't know if you can see it, but I can see I got color into my cheeks and I feel just sleepy. I don't think I can do more. But I just think, Adrea, I mean, You are just an incredible person. Like what you bring to the table with your techniques, your strategies, with integrative medicine, the way you help people conquer cancer, it's so inspirational. And I just feel I'm sitting here in pretty good health and I'm just feeling zen like. Got a Conyers, my Conyer just went through the exercise as well, and he's feeling zen like. And we're both sitting here saying, uh, let's go in peace right now and let go of everything and feel good about our day. I can't be more grateful, Adria, for having you back on the show. I appreciate you so much.
I am grateful for you, Erin. Truly. You help so many people, and I'm just one of the people you tap to help your people and others. I'm grateful for you letting me share my work, which I love. It's my
Wonderful.
passion, my
And
purpose.
everybody here, connect with Adria. She'll take us through this process. We're going to be back. We're going to do it again. And Adria, just appreciate your time so much. Have a wonderful day.
Let me just say, everybody should do with their other hand exactly what we did with the one hand. You do the exact same thing, just change hands.
So it's the starting with the thumb and you wrap your finger around gently, right?
Right. You
Then you
take your
set it
left.
in the rose petals.
Now you're taking your left thumb and then your forefinger, your index finger, all those fingers go into the palm of your right hand, surrounded by the rose petals. And you can back up in your presentation. And instead of doing right, just do left, and I can walk you through it all over again.
Thank you, Adria. Thank you so much for your time today. We appreciate you so much.
My pleasure. Blessings.
Blessings to you.
Bye.